Everybody, Dr. Wegerif here at Pure Plastic Surgery for another Thursday Docs. Today we're going to be discussing a topic that we often get questions about, and sometimes it's not a very straightforward answer. So that's second round liposuction or revision liposuction if you've had it previously for other reasons. And so what exactly does that mean? There's a few reasons why you may get a second round of liposuction or get a revision liposuction procedure. One is you had liposuction a long time ago, you've gained some weight, and you just want to thin out those areas again. We can do that. Second round liposuction, or if you want to do a second round for a BBL to obtain more fat to be able to graft, that's another reason. Or you're just not satisfied with the liposuction procedure you've had before. I'm not talking just with me, potentially with a different surgeon, and you were left with a poor contour of your skin or a lumpy, bumpy appearance. And these are some of the problems that we run into with liposuction. The first thing I'm going to stress is that liposuction is not a minimalist little procedure that you should just get with anybody. It's something you should really look into before you do it, because it is most effective and easiest to do a great job with liposuction the first time you do it. So really choose your liposuction surgeons, prudently. Do it with someone who does a lot of it and does it frequently, because you can definitely get varying results with different people who may not prioritize that as a large part of their practice, where we here at Pure Plastic Surgery, all the surgeons here do a lot of liposuction. So what happens after we do liposuction? After we do liposuction, your body is healing, it's contracting, it's getting rid of a lot of fluid, but it's also forming scar tissue underneath the tissues. And so different techniques with different liposuction can lead to varying degrees of scarring. And if you over liposuction certain areas and you make it really thin so that it's basically the skin healing back down to the muscle, you can have a really poor contour or poor appearance of the skin because it's getting stuck to deeper tissues and it doesn't have the normal laxity associated with skin. That's why it's really important to choose wisely who you're getting your surgery with. All right. So especially for my patients that I was the one who did your first round of liposuction and now you're coming back for a second round for a BBL or something, or for a second round BBL, I have considerably less concern about doing your surgery because I know how it was done the first time and I kind of can expect a certain degree of scar tissue, but I know that I leave a certain layer of fat in between your skin and your deeper tissues like your muscle. And so I'm less hesitant to go in to do that revision surgery. Do I do revision surgeries on patients that have had liposuction with other surgeons? I do, but that is a little bit more case by case basis. It's not a 100% that I'll do it for everybody. Also, we need to think about, is liposuction truly the best procedure for revision for you if you had issues like contour irregularities or a lumpy, bumpy appearance afterwards? Sometimes, like I said, if the tissue is really adherent to deeper structures like muscles, especially in the front of your abdomen, doing another round of liposuction may not actually help that, and it could alter the blood supply to the skin and cause significant scarring or other issues. And sometimes a better option is to do a procedure like a tummy tuck to elevate all those surfaces and pull it tight and smooth out the contour. So it's just a variable thing from patient to patient, and I like to really get very good detailed pictures and do an exam to decide about moving forward with the revision surgery if you previously had it with a different physician. It also sometimes comes into play what kind of devices they use. There's one device, not Vaser, but laser, like laser beams, laser liposuction, that tends to lead to significantly more scarring. And so if you've had a history of laser liposuction, you might want to be hesitant about getting a revision case. Whereas we use Vaser, and Vaser is actually a tool that we may use for revision liposuction because it can help break up some of that scar tissue and give you a smoother contour. I hope that answers some of your questions about revision liposuction or secondary liposuction. If you're interested in booking a consultation, please go to pureplasticsurgery.com to book that consultation. And do we have any questions from the audience?
Yes, there's one question that says, so if you lose 100 pounds, should you do lipo or skin removal?
If you lost 100 pounds, skin removal is going to be the best option for you.
Okay, and what is like the max of liposuctions you can do?
So in the state of Florida, we do have limitations on how much fat we can remove at one time. If we're doing strictly a liposuction procedure or a BBL, that's up to 4 liters of fat we can take out in an office space like we have here at Pure Plastic Surgery, or an office space operating room. And then it is limited to only 1 liter of fat if we're doing it combined with other procedures like a breast lift or breast augmentation or a tummy tuck, something like that.
Okay, and do you recommend getting more than one liposuction throughout the whole year, or like
No,
spaced out?
definitely if you've had one round of liposuction, ideally wait at least a year before you're getting a secondary liposuction procedure, because that gives your body an opportunity to heal and to soften that scar tissue that can be problematic during revision liposuction procedures.
And this is not a question, well, but everyone's like, oh, can you offer like summer internships, all that kind of stuff? Because I feel like everybody wants you as a mentor.
I actually need to look into that. I'm not sure if our insurance here at Pure Plastic Surgery allows that, but it is something I've been meaning to look into, and I will get back to you guys on that question. All right, everybody, have a great day. I hope you have a good weekend, and I'll see you next week.
Bye. Thank you so much, Doctor.